I know that beyond the medical concerns, you have a lot of practical questions about your life and your wallet as well. To answer some of those, let's bring in NBC News senior business correspondent Stephanie Ruhle and NBC News investigative and consumer correspondent Vicki Nguyen. So, Stephanie, let's start with you. A lot of people, myself included, worried about their 401ks. The stock market's been all over the place. It's taken a beating. What do you tell people to do?
I get it. I completely appreciate, I understand why people would be this stressed out. When you look at the markets this often, it's panic-inducing. Now, what this is, though, this isn't a financial crisis. It's not the crisis that we were in '08. It's a public health crisis. The real issue, though, is this public health crisis, if it is not addressed in a quicker, broader way, then it is going to turn into a financial crisis. If you look at the way the market is responding to the president, when the president says, yes, we're going to do something for small businesses, and then he continues to compare this to the flu and continue to say this is not a big deal, people should go to work, business leaders know. Business leaders are taking draconian efforts to limit the amount of exposure for their consumers, for their employees. So when you see that split, that's when things are starting to get really shaky in the markets. Now, for those of us that aren't professional investors, do not dive into volatile waters at the rockiest times, but you definitely want to stay informed at a time like this. And if it is a year when you're looking to retire, I can't say that I have great news for you, but I can say hang tight.
How concerned should viewers be about this health crisis turning into a financial crisis like you were talking about? Because it's something I think on a lot of people's minds right now. It's
fair to say really concerned. In 2008, when we did face the financial crisis, remember, the Treasury Secretary was Hank Paulson, the former CEO and chairman of Goldman Sachs, an expert in crisis management and risk management. What we're looking at right now, the president isn't armed with people like that around him. We know he's very angry with his Fed chair. We know that the Fed cut rates last week and it didn't help anyone. So can I say, no, you shouldn't be worried? This could turn into a financial crisis. And we know certain sectors are bleeding into recession already. Travel, leisure, hospitality, and forget the markets. We need to talk about the real economy because we forgot about the real economy after the financial crisis. After the financial crisis, we kept looking at markets. And a few years later, we said, banks are back, autos are back, we're in good shape. We weren't thinking about all the people who lost their homes in the subprime crisis. This is a consumer-based economy. When we keep saying people should work from home, what do we say to people in the service industry? If you're a barber, if you're a hairdresser, if you're a waiter, yes, maybe we're going to give small businesses some loans, but if a restaurant is empty tonight and it fills up in a month, still, you're not going to make up for all that money you lost. There's a real problem that our consumers are going to face right now for real Americans. And the problem could be that people living at or below the poverty line are going to suffer the worst. And that just keeps going on and on, because if you're a construction worker, you can't work at home. There's a lot of jobs you can't work at home. And so it's going to be interesting to see what happens. Dr. John, you were talking about the importance to take this social space, be 6 feet apart. Well, in a homeless shelter, you sleep 6 inches apart. Exactly. So hopefully things smooth out a little bit here. But with coronavirus, we've got to be aware. If we're aware and we talk about it, well, then maybe we can start to solve for it.
One of my favorite things you said actually earlier this week, Steph, was about going to your local nail salon or supporting your local business, supporting your restaurants. We're not being told to stay on lockdown right now. We're just being told to practice good hygiene and avoid large crowds, especially if we're 60 and above and have underlying health conditions. So for the folks who don't fall into that category, it's okay to live your lives and continue on. It is a luxury to work from home. Most people can't do that. And there's a big economy that relies on the people that do work out in those service sectors. So we should be supporting them.
And we'd like to ask people to try to get a little creative. Let's say your fitness center has virtual classes. Try to do that. Because that fitness center you love, the teacher that you love, if nobody shows up for their class, then they're not getting paid. And they're not going to be there any longer. And they're not going to be there any longer. Exactly. And when we get past this, and we will, I know we want our communities to thrive. Exactly. And with corona cases on the rise, demands for products to prevent the spread is increasing. That's creating a major problem for consumers, price gouging. So, Vicki, we're hearing people feel like retailers are taking advantage of the situation. Are we seeing price gouging? Is it happening?
Absolutely. And governments are taking zero-tolerance policies on it. One of the most egregious cases, I think, that hit the headlines this week was the 7-Eleven owner in New Jersey who put some homemade hand sanitizer on the shelves. Someone bought it, sprayed it on some little boys, and they got chemical burns because this was not an approved hand sanitizer. It was something made with commercial-grade cleansing fluids. So we're seeing not only price gouging, we're also seeing these homemade concoctions that people can't trust. So there are people who are really trying to take advantage of what's happening in this scenario. $150 for it is.
Let's just take a minute.
100%.
No,
that is sick, Jersey. It's my home state.
It's allegations right now, let's just say. But yes, $150 for a bottle of Purell. A mask that normally sells for $2, $75. You don't have to go far. Look on any online marketplace. You will see those sellers who are looking to capitalize right now.
And you might notice in the background here, the cleaners, you can see them right there. They're doing a great job of keeping our building clean, and they've actually ramped up their efforts over the last few days, and they're going to continue to do that. And I think that's what most buildings are doing.
But the question to you, Dr. John, as parents, we're saying, I guess we should go out there and get masks. Is that even a good idea? Do they even work?
They work in the medical profession, they work in our hospitals, but they don't necessarily work out in public, and I think they give people a false sense of security. So that's one of those things that, and number one, we need them in the healthcare environment to take care of patients because we're walking in and out of these rooms and protect the patient and ourselves. And if people are using them, we're not going to have that supply. And so you have to be very, very careful with that. And most recommendations are not to use them.
And can we help assuage some of the fears, too? Because I think the human tendency is, I want that thing that I can't get. When I see the store shelves empty of the wipes or the hand sanitizer or what have you, I feel like I have to have it. You brought up a great point. We didn't have hand sanitizer 10 years ago. We had good old bar soap and water, and that is still the #1 gold standard for helping us protect ourselves from coronavirus.
I get this question all the time. What do I do if I can't find hand sanitizer? It's like, wash your hands.
And don't touch your face.
Don't touch your face until you wash your hands.
It's very simple. It's hard to accept, but that's truly it. If you can't get your hands on a mask, you don't need a mask. If you can't get, disinfectant wipes, you don't need those. Just wash your hands often. And if you can't, don't touch your nose, right? Your mouth, your eyes.
Exactly.
You could literally have coronavirus on your fingers. Right. As long as you don't touch your eyes, nose, or mouth, you're not going to get sick.
Exactly. It does not go through your
401k
skin.
advice is the same. Don't touch your face. Don't touch your 401k.
I love that.
And also, think about people who are clearing out the shelves of a grocery store or a Costco.
Right.
Do you know who can't do that? The people who are living paycheck to paycheck. So they might need that one container of soap or that Purell. They can't get it if there's none left. So be cognizant of all that we're taking.
And even like things, essential things, toilet paper. They're going to run out at some point. They need to
We are all in this together. And I think about our neighbors. This is sort of the time where you have to kind of look, be prepared, be ready, take some personal responsibility. It's also a good idea to look out for the folks that live around you, especially who might not have access to the same resources that you do.
And switching topics just a little bit here, people, even if they want to avoid getting sick or they're quarantined, there's another potential disruption to our lives. And that's where we're getting a lot of questions about travel plans, about people going out and about. Is my trip going to get canceled if I have one in the near future? And should people be worried about that?
Yeah, well, right now, as we know, coronavirus has hit every single continent except for Antarctica. And the CDC has issued serious travel alert warnings for many countries. So this is a developing situation, literally changing hour by hour. The best bet is to continue to follow. Call your travel agent or the airline that you're traveling on to see what those updates are. That could be changing daily. On the flip side, if you're healthy and you have a trip planned, this could be a fine time to travel. Just, if you can, bring some wipes to sanitize the area around you, the headrest, the seatbelt buckles, any surfaces that you're going to be touching on that flight. Don't touch your face. You'll be fine. You'll probably have the whole row to yourself, if not the whole plane. I mean, we were talking to someone who came back from a North Carolina flight. 100 seats, there were 20 seats taken on that plane.
But
so,
I wouldn't assume if you want to cancel, you'll get a refund or you'll get a credit. This is a time, if you want to make plans, spend the extra money and buy the refundable ticket. Don't assume if this gets worse and there's more warnings, you're going to be able to get let out of that trip. Because
but even with the trip insurance, that might not cover you at this point, correct?
Right.
Correct.
Because it costs more. There's something called CFAR insurance, cancel for any reason. Typically 60% more for the premium, and sometimes it only covers about 75% of the non-refundable costs. So this is a time to read the fine print. It is not one size fits all across the airlines or cruise lines. Don't make assumptions. You're right. That's where everyone gets in trouble. But I will say and give credit to the airlines who are trying to be flexible, who are really trying to goose the market and get people back into the travel flow. And maybe by the summer, things are going to look very different. And right now, there are some screaming deals to be had on round trip tickets. But read the fine print. Make sure you understand what the cancellation fees are and the change fees are.
We might see, I'm not calling it a government bailout, but specific industries like the airlines, you might see the government step in and try to do something. And I don't believe we would see the same kind of public outrage that we saw in the financial crisis, because this is much more like a natural disaster. And the airline CEOs, some of whom have already foregone their salaries for the rest of the year, are trying to solve for this. And it's not just executives that they employ. Think about it. From the pilots to the flight attendants down to baggage handlers. It's an entire industry. Think about all the people you interface with when you go to an airport, many of whom are low-wage workers. You're going to consider all the jobs that are impacted here.
Yeah, it's a whole ecosystem.
And to try and get this under control and to try and, what they say, flatten out the curve, to try and not get it to spread quite as quickly, a lot of companies are urging employees to work from home in an effort to help slow the spread of the coronavirus. But that's not necessarily an option for everyone. Stephanie, what can people do if they can't work from home?
I mean, that's the thing that we're not even talking about that much. What if you were a carpenter? There are many jobs that you can't. We've got 2 million people that work in trucking and ground transportation and people in the gig economy. And if you think about those in the gig economy, they're not actually employees of anyone. They don't get health care. They're working as independent contractors. They don't get all those benefits. That's something that the government is taking a very close look at now. And one of the reasons there's not regulation or support, these are new businesses. The gig economy didn't exist 5 years ago. So there isn't necessarily regulation to support those employees. So at the very least, it's a positive that you are seeing the government look at it, and you're actually seeing companies. You're seeing companies like Starbucks and Lyft think about their shift workers and say, it's time to give you paid leave. Olive Garden did the same thing. When was the last time you saw a restaurant, and you could only see it happen on a corporate restaurant, not a mom and pop, say, let's think about those employees and what it means to them, because they are full-time workers.
And I've been on both ends of that spectrum, where I've been the employee who was told, hey, go home, and I have a corporation behind me. I've also been a small business owner, and there's a lot of pressure to have workers stay at home, but that's not always going to work for them. I
mean, let me just tell you what's also heartbreaking. If you're a small business owner and you say, you know what, I'm a catering company, I've got to go to work today, but lots of your clients are canceling, then what are you going to do? You have to send all your cooks home. You don't want to. You'd love to put them on leave, but you're a small business. You don't have that luxury. So I think we really have to consider, when we keep wringing our hands saying, well, employers need to do this, that, and the other thing. Not all employers are mega giant corporations.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.